This morning, new research is linking marijuana use to higher risk of heart attack and stroke.
Since Colorado is one of the states where marijuana is legal, we wanted to bring in our 9 News medical expert, Dr. Payal Kohli, to explain a little bit more about this study in detail. Dr. Kohli, good morning.
Good morning.
What exactly did the study show about marijuana connected to heart disease?
Yeah, marijuana has been around for hundreds of years for medicinal use. And more recently, we've seen a lot of people, including our state, use it more recreationally. This is not a surprise to doctors, but I'm hoping that it sends a message out there that marijuana has been associated with a higher risk of heart attacks and strokes. And it's actually quite dramatic. So 25% higher heart attacks and 42% higher strokes in individuals who used marijuana daily as opposed to those that didn't. And this is even people without a prior history of heart disease, including young people as well. So really a wake-up call for a lot of us that use marijuana recreationally, thinking it's completely safe, but the doctors want to send a message that it's like tobacco 2.0.
Is this for any type of marijuana use, like smoking, edibles, anything like that?
So yes, it includes all types of marijuana use, but the majority of people actually ended up using marijuana smoking. So about 3/4 of people smoked it. The rest of you were using it in edibles or other forms as well. But you can imagine when you smoke marijuana, the way that it enters your bloodstream, gets into your brain, is through that smoke, which is very toxic to our blood vessels, very much like cigarette smoke. In fact, it creates a lot of the same inflammatory changes. It creates a lot of the same types of immune system changes. It can cause that chronic cough that smokers can have. It can activate our lungs to have bronchitis and all types of other problems as well.
Okay, interesting. So marijuana use, of course, has been pretty common for quite some time, as you were just talking about. Why is some of this data just now coming out? Why are we just learning about the effects of this?
Well, this was the largest study, but we've had some smaller studies that have linked marijuana use to heart disease, marijuana use to cancer, problems with memory and attention. But really the challenge has been twofold. First, it's not federally legal, right? So it's hard for us to do lots of studies on it because every state has kind of their own rules about marijuana, and so a lot of people don't admit to using regular marijuana. Second, in the past, it was mostly the young people that were using it, but in fact, recently we've seen that seniors above the age of 65 have a twofold increase in the number of people that are using marijuana, because again, it's becoming very trendy, it's considered very safe, and people forget that it's actually a drug, and it's actually a drug that can have significant toxicity.
Yeah, interesting.
So that's my question. Earlier you said, a lot of people think, oh, marijuana, it's safe, it's natural, whatever they may say about it. What is your advice for people who use marijuana recreationally?
I would say if you are going to use it, remember that it can have a lot of these effects. So try not to use it daily. Maybe once in a rare while, because we're seeing what's called a dose-dependent relationship. So if you want to use it recreationally once in a while, try not to make it a daily habit. Don't use it every day to sleep, and that's a bad behavior to develop. Second, I would say if you're going to use it, maybe try edibles instead of smoking, because they don't activate the immune system in the same way, with a caveat that the dose that you're getting in an edible can be really tricky, right? And it takes a while to kick in, so it's very easy to sort of overdose. And what else you have in your stomach can affect how much dose you're getting as well. And then finally, I would say talk to your kids, because we're seeing that 1 out of 3 high schoolers have admitted to using marijuana, with 1 out of 4 of them saying within the last month. And even middle schoolers now using marijuana and using it in different ways, smoking it, edibles, vaping.
Yeah,
so young.
And there's questions now about how that's going to develop, when lungs are still developing, how that's
and the brain as well.
And the brain as well. So of course we'll wait for that study to come out, and you'll have to come back on and describe that to us. Thank you, Dr. Kohli. We appreciate you. And don't forget, you can all find all of Dr. Kohli's appearances at 9news.com/Dr. Kohli. Now let's get checked with